So, hi everyone, and welcome to today's launch event for the Primary Care Improvement Collaborative. My name is Elaine and I'm a project officer within Healthcare Improvement Scotland, and I'm just going to take you through some basic housekeeping before we begin the session. So I will go on to the next slide. So just to remind you that this webinar is going to be recorded and that a recording will be available after the session, and that any chat, if you put any messages in the chat box, they'll not be viewable on the recording once we share this afterwards. And a few other basic housekeeping just to go through is that we've muted everyone's cameras and microphones, just to ensure you get the most out of the webinar, and just to minimise noise interference and maintain streaming quality throughout the session. If we need you to speak during the session, we can enable your microphone or cameras, so that's not an issue. And we would encourage everyone to engage in the session through the chat box. There is, as shown in the slide here, you can reply to people's messages direct if there's quite a lot of activity in the chat. And if there's any questions, we'll try our best to answer them throughout the session, and if not, we'll get back to your questions afterwards if need be. And yeah, you can also use emojis as well to react in the chat box. And also, if you require captions throughout the session, along the top of your screen, there's the 3 dots for more options, which you should be able to enable live captions if need be. And that's it from me, so I'll pass over to Alison to begin the session.
Thanks, Elaine. Hi, everyone, and welcome to this session. It is really, really great to see you all here. My name is Alison Serran. I'm a Senior Improvement Advisor in the Primary Care Improvement Portfolio, and I've been leading the really big team of people who've been working to put the plans for the collaborative together. And you're going to meet some of them today, and you'll meet others as we work together over about the next 18 months. The team are going to take you through some information later in the session that tells you about the detail of what we're doing, and all the opportunities for you to get involved. But I am just going to give you a tiny bit of context to make sure that you understand how it fits into the wider work that's going on at the moment. So I'm sure that many of you will be aware that the Primary Care Improvement Collaborative is part of a bigger programme that's called the Primary Care Phased Investment Programme that Healthcare Improvement Scotland are helping to deliver along with colleagues across different parts of the NHS and in Scottish Government. And there are a few aims for the programme, and thought it might just be helpful to share those now. So some of the things that we're trying to do through that programme are to really develop a culture of continuous improvement across primary care settings. So we know there's already a huge amount of improvement work going on in different settings, and from some of you, we've worked with you previously, and it's really great to have the opportunity to work together again. But through this collaborative, we want to continue to develop that to make sure that people are feeling really confident to work on quality improvement and that they have some support to get started as well. We want to improve the implementation of the contract, and particularly specifically of pharmacotherapy and CTAC services, while maintaining all those other really important primary care services. And we want to build some evidence, and we've got a great team working on developing the measurement plans and evaluation plans for the whole programme, so that we can build the evidence to really understand the national context for implementation and to help inform our colleagues in government about that. And so there are 2 main parts to the phased investment programme. The collaborative, which we're here to talk about today. And then I just wanted to touch on the other core element, which are the 4 demonstrator sites. So we're working with 4 sites across the country: Shetland, Borders, Ayrshire and Arran, and Edinburgh City. And with these sites, they're working on the kind of big changes. So there's a bit of a list here on the slide, but we're working on system level changes. And and that's where a lot of the work will be going on to build evidence around the implementation of the contract. One thing that we really want to do across the programme is make sure that we're sharing learning, so that we're sharing things that are happening in the demonstrator sites that are looking really good with you, and we're sharing fantastic things that we find in the collaborative back to the demonstrator sites, and then beyond that as well. But having joined the collaborative is a really great way to be first in the queue to hear about the learning that's coming out of the programme as a whole. And so then what we're here to talk about today is the collaborative and how we'll be working together. So far we've had about just over 100 applications, and we hope there might be others who want to join us as we go through the 18 months as well. And the collaborative offer is for teams who aren't included in one of the demonstrator sites. And what we're going to be working on is more changes that are at a team level, or perhaps a GP practice level, and process changes to see where we can make some improvements to hopefully make life easier for patients and for all of you working in the services. And in developing the way that we're approaching the collaborative, we've really drawn on learning from some work that we've been doing previously. So the work of our primary care access programme, PCAP, of our pharmacotherapy programme, and the pharmacotherapy quick start sessions that we've run last year, and of the CTAC network. And so we're drawing on all that knowledge to develop the offer that we've got so far. And we'll be working together to make improvements to some aspects of some of those areas. And I think just at this point, really important to say that access covers a huge range of things. And we're really excited that we've got some teams that are not practices, that are not pharmacotherapy teams, CTAC teams, who've joined us. So some other primary care MDTs. I'm really looking forward to working with you to make some improvements as well. The team will talk you through more how the core elements of the collaborative work, but importantly, you can choose what you want to participate in. We hope that everybody's joined because you're quite keen on doing some quality improvement work, and we'll be really wanting to hear about what everybody's working on, whether you participate in some of these particular activities or not. I just wanted to say something about sprints. So the first thing on this list is short improvement sprints, and in the collaborative, a sprint is a really focused block of improvement work. So it's a time where you say, we've got enough time, we can scratch out enough time just now to work with our team in a really focused way over a short period of time. We've previously in PCAP done some 7-week sprints, and in the pharmacotherapy some 8-week. We've gone to 8 weeks for the collaborative, or 4 weeks, just because that allows us to work with the maximum number of teams possible. So it helps our coaches to be able to pick up a few more teams than they would have been able to previously, and to make sure we're being consistent across what we're delivering. And those 8-week sprints will be for where you've got some really tricky problem and you're not sure where to start. The 4-week sprints are much more thinking about where we know there's some tried and tested solutions. We know which tools to recommend, change ideas, and we can work together in a really rapid way that the team will take you through some more of the detail. Finally, I just wanted to say that we would really like your feedback. So we have some plans, and we're going to present those plans today, and we hope that they look good to you. But we also want this to be something that we continue to design together, and we want to hear your feedback about the plans we've got. We'll be asking you today, but we're also happy to hear at any time if there's something else you would like to do, if there's anything you feel is missing, if there's anything that you think we could do differently to help you in your experience through the collaborative over the next 18 months. So I will hand over to Adeline, who's going to tell you a bit more about what we're covering today. Thanks, Adeline.
Thank you, Alison. Hi, everybody. I'm Adeline Tan, and I'm the Improvement Advisor in Primary Care Improvement Portfolio. Before I begin, I would just like to know a little bit more about you. So would you be able to tell me in the chat box your name, your job, and which health board or HSPC you're from? And as we do that, I'm just going to go on to zoning in into why we're here today. So you've heard Alison tell you a little bit about the phased investment program. We're talking about the whole collaborative today. And at the end of today, I'm hoping that you'll be able to know a little bit more about the program that we have developed. We will explain the collaborative program outline, and we will introduce the possible tools and approaches that we'll be using during the collaborative. We'll explain into a little bit more detail of how to sign up to the sessions and the sprints, and we'll give you a breakdown of the sprints whenever they're available. Thank you so much. I'm seeing all the names coming in, and it's so great to see a wide range of people from different parts of Scotland. I'm just going to leave few more seconds for people to just put the information into the chat box. But you shortly see a poll that's going to come up onto your screen. We want to know if you have used any QI tools before, and how confident are you to use these QI tools in your work setting? And if you have not heard of what quality improvement tools is, or you've not used it in your work setting, please let us know as well. So we've got the first question up, and then shortly you will see the second question asking you how confident do you feel using it in your workplace. Thank you so much. We're still having a lot of information coming into a chat box, and that's great. I'm hoping that throughout the rest of today that everybody would just participate in the chat box and just feel free to just give us information and give us your feedback. You will see some of the responses in the chat box as well. That's good. We've got quite a big spread of people who are not confident, very neutral, neither confident or not or not confident, and some have not used QI tools. So I'm hoping that throughout this collaborative, that we'll be able to help you to increase your awareness and experience in using these tools. The responses are all still coming in, so please keep them coming in. But I'm going to hand over to Erin now, who's going to take you through to more in-depth information around the three elements that we'll be doing.
Thank you, Adeline. Good afternoon, everyone. My name's Erin Sinclair, and I'm an implementation and improvement facilitator with HIS. So the collaborative consists of three elements: sprints, quality improvement or QI skills sessions, and support and learning sessions. They're open to all primary care teams. You don't need to participate in all the work streams, and you can participate in as much or as little as you like, and you can pick and choose which work streams you want to be involved in. During the collaborative, we'll support you to apply QI skills, work in small-scale tests of change to improve services and share our learning with each other in the demonstrator site teams. We've developed a timeline and plan so far, but keen to get feedback from every participant. We will have a section later in this session today where we would like to discuss our ways of working. To confirm a place in the collaborative, please complete your MOU and team information forms. We're able to add all your team members to the collaborative MS Teams channel also. We have been in touch if we need more details with regards to your application. Please contact us if we've tried to email or call you. And if you've got any questions regarding this, please pop them into the chat box. So what is a sprint? Our 4-week and 8-week sprints have been designed and tested with our colleagues in primary care services, and they're a combination of quality improvement and sprint approaches to changes in healthcare services. A sprint is a fast-paced approach to allow teams to improve healthcare services in a relatively short space of time. We do require you to participate in weekly sessions. So initially we started working with teams on 8-week sprints during PCAP, and we've since developed the 4-week sprints for this programme. These are shorter and focused on specific topics that have been previously covered. They're available to all teams within the collaborative who have requested to participate in a sprint, and we will contact you to invite you to specific sprints. We'll also provide ongoing support and coaching. Our QI sessions and support and learning sessions are available to all teams within the collaborative. You can attend as a team or you can attend individually. Individuals or teams can register for sessions that they would like to attend, and we will send a meeting invite to confirm your place. These sessions will take place monthly. Sprints are open to all teams who have signed up to the collaborative. Any primary care team interested in using QI to improve an aspect of their service, be this GP clusters, GP practices, pharmacotherapy and CTAC teams, or any other primary care multidisciplinary team. The benefits for participating teams include exploring access, prescribing and community treatment and care CTAC challenges. Select a specific area to investigate and improve using tried and tested improvement tools. Test changes and monitor improvements, and also share learning with clusters and further afield. The structure will be in the format of either a 4-week or an 8-week sprint. The 3 sprint work streams are the Primary Care Access Programme, or PCAP, pharmacotherapy and CTAC. To take part in a sprint, you need to be in a team and participate. You must be able to identify an improvement team, including a decision maker, a team lead, administrative support, and key partners where applicable. For example, a general practice for a CTAC or pharmacotherapy team. You must also be able to commit 2 to 4 hours per week over the period of the sprint. This will be a mixture of sessions between the HIS team and also time for you to work on the project within your own team. Please add any questions to the chat box regarding this if you have any. The format for the 4-week sprint will start with a pre-sprint introductory call. Week 1 will be an introductory session. Week 2 will be a coaching session focused on change ideas and measurement planning. Week 3 will be a drop-in session focused on testing and implementing change ideas. Week 4 will be a next step session. There'll also be a follow-up around about 12 weeks after the next step session, and we also may invite you to one of the support and learning sessions to share your progress. The topics for the 4-week sprints are workflow optimisation, acute prescribing, call volume, care navigation, serial prescribing, workflow optimisation, and pharmacy hub working. The format for the 8-week sprint, again, will start with a pre-sprint introductory call. Week 1 will be a welcome session. Week 2 will be a coaching session on data collection. Week 3 will be a coaching session on selecting change ideas. Weeks 4 to 6 will be optional drop-in sessions. Week 7 will be an update on your project. Week 8 will be a next step session, and again there'll be a follow-up around about 12 weeks after the next step session. And again, we may also invite you to one of the support and learning sessions to share your progress. The topics for the 8-week sprints will be care navigation, polypharmacy reviews, high-risk medicines and appointments. All this information is in the handbook attached to the diary invite. It's worth noting that the 2025 dates are estimations at present also. We have contacted the teams for the first sprint starting the 29th of April to offer them a space. The team should have completed and sent back the information that we've asked for. If you've not yet replied to this email inviting you to attend a 30-minute introductory call with a coach, please could you do this by the end of this week with your completed MOU and team information. Your coaches should have been or will have been in touch to organise a virtual introductory call with your team for next week. We'll also be allocating teams to the upcoming sprints for this year, and we may contact you if you have expressed interest in specific topics to invite you to attend specific sprints. And I'm now going to hand over to my colleague Niamh. Thank you very much.
Hello everyone, my name's Niamh Gallagher and I'm another implementation and improvement facilitator in the primary care team. So the QI skills sessions are another element of the collaborative. These sessions are open to everyone who has signed up to the collaborative, demonstrator sites, and then PCAP and pharmacotherapy alumni. You can sign up individually or as part of a team, and you can sign up to attend as many of these sessions as you like. In these sessions, there will be examples of practical applications of QI tools in primary care, And later on in this presentation, you will hear some of the benefits from a previous team who has used QI to implement change in their own work area. Participants will build confidence in using QI tools, and there will be the opportunity to hear the experiences from other teams. The QI skills sessions will be monthly 30 to 45-minute virtual sessions on Teams. Sessions will be recorded and then published on our webpage and collaborative Teams channel. So this table outlines what we have planned for the QI skills sessions in the coming months. Each month we will focus on a different QI tool. We will explain what the tool is, why it's useful, and how the tool can be used in a primary care setting. If you would like to attend any of these sessions, you can register via the link in your handbook. The final element of the collaborative is the support and learning sessions. This is available to everyone who's signed up for the collaborative, and again, you can sign up individually or as part of a team, and you can sign up to as many sessions as you like. In the support and learning sessions, you will share learning ideas, resources, and top tips. Teams will be able to showcase their work. You can ask questions and get peer support, and you will be able to make local and national connections. The support and learning sessions will be monthly 1-hour virtual sessions on Teams. There will be 1 session per work stream per month, and previous PCAP teams will be invited to sessions and they will share their experiences of quality improvement within their own organisations. So this table highlights the dates and work streams for the support and learning sessions over the next few months. We would welcome your thoughts or recommendations if there's a particular topic or speaker that you would be interested in hearing from. Also, if you'd like to tell us about your own improvement work or you would like specific support, please just get in touch. It's worth noting that we require a minimum number of 9 attendees for sessions, and if numbers were less, we may consider combining these sessions. Again, if you'd like to attend any of these sessions, you can register via the link in the handbook. And I will pass over to Adeline now.
Thank you. So what you're going to hear is a team who have gone through one of our sprints with us. The new surgery has gone through a pharmacotherapy 4-week sprint with us, and Rebecca Green is going to share her experience with her coach, Gareth Fitzgerald. Thank you. I'm sorry that some of you couldn't hear the recording. We can hear it quite well here, but what we're going to do is we're going to send the recording to all the people who've registered. So hopefully you'll be able to hear the recording when you have the webinar recording. At this point, I just want to ask if anybody has any questions with regards to the new surgery and the information that they've shared. Or any questions about the collaborative with the 3 work streams, the sprint, the QI skills, or the support and learning session? So what we're going to do is I'm going to move on to the ways of working. But before that, can I just pick up somebody's question about whether all the teams have been contacted regarding the MOU? Yes, so we have sent out all the teams who've registered, submitted the application form with the MOU. And we would want you to submit the MOU as soon as possible so that we can start allocating the sprints if that's what you've asked for, as well as to send you the handbook. And also to add you onto the MS Teams channel. So Lindsay is asking if there's a copy of the new surgery acute prescribing protocol. So that's great. We'll be able to liaise with the new surgery around that request. Okay, So what we're going to do is we're going to move on to our ways of working, and this is a proposed ways of working. And I'm hoping that this will be an interactive part. And if you feel that you would like to ask some questions, you can pop in the chat box, or if you're brave enough, just raise your hands and then you can come on and ask a question. Thank you for being patient with us the last few months as we developed the collaborative timeline. This collaborative, although have been launched by us, it does belong to every participating team and every participant. You play an important role in shaping how the collaborative will be and how it will look like. The timeline for the collaborative, especially for the sprints, have been planned and they're provisionally planned for 2025, but they can be flexible with the timing, when the sprints are happening and what are the topics, especially for the 4-week sprints. We want to make sure that we meet the participating team's needs. We have already made some changes to the sprints. If you remember the timeline that Erin showed you, we have made some changes in terms of when we're going to host some of the 4-week sprints or some of the 8-week sprints. We may make changes later on in the collaborative if we need to. So feel free to share information with us. Let us know if the collaborative is not meeting your needs and any suggestions that we can do to help you meet those needs. If you have joined the collaborative and you know of other teams in your area who are interested, whether they want to join the sprints or just want to drop in and hear the QI skill sessions or learn about what other teams are doing with good practice out in Scotland through the support and learning session, please get in touch with us through our team email so that we can explore options with them or signpost them to our collaborative webpage where they can sign up to the collaborative. The MOU is important because we are asking for your team members' contact details so that we can add them to the collaborative MS Teams channel. We are suggesting different ways how teams would like to communicate with us. We have set up the collaborative MS Teams channel that is dedicated to all of you. We hope that you'll be able to use the MS Team channel to network, and we will facilitate this as much as possible. We hope that you're able to use the channel to share good learning among each other, build connections, share learning. We are also going to be looking at sharing learning across the collaborative and demonstrator sites, as Alison has said in the beginning. We will be sharing some of the learning between the two areas before the beginning of summer. If there are any suggestions that you've heard so far that is missing, whether it's the 4-week sprint, 8-week sprint topics, or something that we have not considered, any of the topics in QI skills that you would like us to talk about, or if you know of any teams that have done good work that you would like them to share in the support and learning sessions, please let us know. We will do our best to facilitate that. There are several ways you can let us know. So you can either put them in the chat box now. We will have a MS Forms at the end of today for you to give us the information. Or you can email us at our team email at any time. The handbook, which was attached to the diary invite, will also be uploaded to the MS Team channel. All the information is in the handbook, especially if you want to sign up to the QI skills or the support and learning sessions. I'm going to pause here at this point and ask if there's anybody who has any question. So how do you sign up to the MS Team channel? We are waiting for your MOU. So your team lead will send us the MOU with the team members' contacts, and we will add them to the MS Team channel. The handbook is where all the links are to sign up for the QI skills and support and learning sessions. So it looks like there's no questions at this point. And feel free to ask them or into the chat box if you have any more other questions. I'm just going to move on now. We have co-produced a bank of resources with previous teams who have participated in PCAP and pharmacotherapy sprints. You will find toolkits, brief insights, sharing examples of the impact teams have done during the sprints, examples of QI tools, and our PCAP Sharing the Learning webinar. And you can access them in our webpage, and the link will come out in the chat box shortly. Thank you so much for being patient with us today, and we have come to the end of the collaborative launch event. Before we finish, we would like to ask you a few questions on your thoughts about the collaboration. So before I go on, there's a question about the introductory session different to the welcome session. So if you have signed up for the first sprint, and that's starting on the 29th of April, we have a welcome session on the 1st of May. That is to introduce you to all the tools we're using, in particular, and the DCAQ tools, which is demand, capacity, activity, and queue, as well as to give you a bit more detail on the 8-week sprint and what's going to happen over the next 8 weeks. The introductory session is before the welcome session, and that's a 30-minute virtual call with a coach, one-to-one, so that we are able to prepare you and to give you some preparation before you come onto the sprint itself. So people who have sent in the MOU, but if you've not been added to the MS Teams, please let us know as well, and we will add that. We'll add you into the channel as soon as possible. So we're going to come to the evaluation part. You're going to see a poll coming out on your screen. We would like you to be as honest as you can with your answers. What aspects of the collaborative are you most looking forward to? And not everybody will have signed up to the sprints, but that doesn't mean that you do not have something in your mind, a little pebble in your shoe that you want to work on. So we'll be asking you if you have any idea what topic you want to work on. Even if you have not signed up for a sprint, you may want to come to a QI skills because you want to learn something to work on an area. Or you might want to come onto the support and learning session to see if there are other good practices or good ideas that you can use in your area. And this is me repeating myself again. If you have any other questions or suggestions around the collaborative, what you've heard today, the activities that we've proposed, or our ways of working and how we communicate with you, please let us know as well. Finally, the first sprint teams have been contacted via email, and we have asked for your acceptance as well as to arrange an introductory call with you, with your coaches for next week. There are some teams who have sent in their applications. We may have come back to you to ask for more details. Please contact us if you have not. And this is, again, me repeating myself, but individual participants can sign up to QI skills and support and learning sessions without a team. The links are in the handbook. And if you have not been added to the MS Teams channel, we will do that as soon as possible. Put that into a chat box and we would sort that out, or you can email us. Finally, we've come to the end of our webinar. Thank you so much for being patient with us, and we hope to see you in the collaborative soon. Goodbye.